Mission statement: Seneca County General Health District, in collaboration with the citizens, promotes wellness, prevents disease, protects the environment, and ensures access to quality health. Roll call.
Here.
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 Here. Everyone stand. Allegiance to the flag of the United States one nation under God, indivisible, with liberty and justice for all. Approval of the consent agenda. Ordinance.
I'll second.
Any discussion? Question for the environment. You know, or, the community, the facilities, report about biofarm. Agreeing this is very different all regulations. The question is, do you do contact with, health or jurisdiction, private state? When it's possible, one of the agency legislation in place, not. Sure, we start as an office.
My tables are a little far apart.
Yeah, you can go down. And what's your motion to approve the consent agenda or specifically the minutes?
Consent.
Anyone else can report it? If you want. Motion, report. We will do the consent agenda, maybe? All in favor, say aye. Aye. All opposed? Now for actual discussion matters. So I have multiple items in different pillars to report on relating to people. As you'll notice later on in the agenda, we've been able to finish filling all of our vacant PHN2 positions, so that's great news. However, our accreditation and health cleaning manager submitted for resignation. Her letter of resignation, my acceptance, and the exit interview are in the packet for your information. And I have also received communication from another member of the admin team that plans to their intent to resign within the next 3 days as well. Staff will be having a Go Red or lemon event. Basically, we're going to be doing the Wear Red Day on February 3rd, which is next Friday. We encourage everybody to do that wherever you are, either at work or just among friends or at home. And I'll be representing the Health District at National Prosperity Community Hospital Red Cross that day. Under the serving pillar, I did receive official notification today that Dr. Sarah Stoll was appointed by the City Council and Mayor to fill the vacant city representative position. She and I are in the process of scheduling the orientation. Under quality, I wanted to share that the 2022 Community Health Status Assessment was released December 31st. A copy is available on our website. You can look at the copy of that tonight with me. We'll be pursuing some additional opportunities to get community feedback on that over the next couple of months before we then move into the community health improvement planning process. We're also starting the process with the Health Alliance of determining the potential costs of our next community health center 3 years from now. The way the Health Alliance is usually done is we try to project the cost on being the Health Alliance. Have tried to project that cost and then broken that down into annual commitments so that when it's time to actually do the assessment, we always have the cash in the answer to that. So that's we've started that process, and we'll be creating a budget to reflect that. Related to the road pillar, building updates, you'll notice if you drive by the building on East Perry Street, many of these stone, what do you want to call it, the stone facade has been, put up. They're getting close to being able to put in windows that are in the top, right-hand corner. The handicap accessible doors will go in at some point after that. There's still walls that are coming down inside too. So they're still anticipating completion sometime in the spring. We've been continuing to work on the strategic planning process, and the admin team has been working on steps 3 and 4 of that process. Step 3 is identifying external trends and factors shaping public health practice in the future. And step 4 is analyzing results and identifying cross-cutting themes and key strategic issues. So over the last several weeks, we've reviewed over 16 publications and reviewed 4 webinars that focus on strengthening and modernizing the public health system for the future. And while we're still in that process of meeting with the key themes are the key recommendations, there have been some cross-cutting themes and strategic issues that have been identified thus far. Those include a need to focus on workforce of the future, in broadening the diversity and capabilities of those staff, retaining staff, and dealing with post-traumatic stress disorder that has been caused by COVID challenges that public health officials and workers encounter. Technology, so much of what we need to do and improve on relates to having the right technology in place. So that's another key part of our infrastructure that we can build on. Funding, obviously, sustained funding for infrastructure is key. There's lots of things that need to be improved, but funding is required for all of them. And that's important as well to attract and retain highly qualified staff. Equity is a core theme across every single article that you read related to public health workforce and public health department of the future. So ensuring that we look deeply into to assess all the populations and their access to healthcare and their needs, whether they have a disproportionate burden of disease, like we saw with COVID-19, those kinds of things. Communications obviously is key too. We already identified that as one of our gaps during the COVID pandemic, and that's why we added the health communication specialist position. And so it's really about having actual, accurate data to the right people, communicate in the right way at the right time. And then obviously data, integrated data systems, data analysis skills, etc. Another update related to our quality pillar relates to, I want to provide some land update. The notice of the board's intent to deny the 2023 operating license renewal was issued to Sunny Farms on January 3rd. We received a request for hearing on January 19th. A copy of that full request is in your packet screen this evening. I met with prosecuting attorney Devon regarding the appointment of legal counsel. And basically the process continued without the appointment of counsel. So that's good. And then finally, make sure I covered everything. Yes.
Next, personnel actions. Next is 2 personnel actions. I'm going to read those. Resolution 2021, approving employment for offices full-time public health nurse 2 effective 2/13/2023. Resolution 2023-02, approving employment for restricted office full-time health nurse number 2 effective 1/30/2023. And considering accepting the resignation of local students, PhD, and PH, our planning resolution manager effective 2/3/2022. Do I check the motion? Second. Close the second. Okay. And yes. Okay. Passes. Next, out of county travel, there was none. And next is the policy actions. Number one, remove the board member from Scott attendance. At the advice of Seneca County prosecutor, and requesting discussion regarding board of vacancy. Board of Health bylaws, Article 3, paragraph 2, membership states. In the event a vacancy is created by death, resignation, significant non-attendance as defined as missing more than 4 regular meetings in the calendar year, or other dereliction of duty is determined by the original appointed authority. Vacancy shall be filled in like manner as the original appointment shall be filled and expired. When the vacancy of a member representing the district advisory council occurs more than 50 days prior to the first meeting in March and soon, the remaining members of the board will appoint members to fill such vacancy until the meeting of the district advisory council. Mr. Scott Lyons to list 5 regular meetings at the end of the year 2022. This time I'm asking for a motion to vacate Mr. Lyons' seat in the Seneca County Board of Health.
President, move that the board affirm its bylaws for Seneca County Board of Health. And that the residents of this, violation of bylaw. Number recognize the seat of being vacated.
Second. The second with
Yes. Can you read the policy, read is September 22nd, 2022.
and that's a previous policy that is not our, that's not the board's bylaws.
But the bylaw before that, page 6 has, after I had 4 absences, you came back, and you changed, already knowing that I had 4 absences. All of the bylaws, 6 absences.
Well,
retroactively, you can't rewrite the laws. You can do anything you want at that point, with any of our bylaws that you want, and then make them for 5 years ago, or for this ago, that ago, you can't retroact bylaws, and then again, years ago. I had that consistent, people like to see actually 6 or 7 already. That being the first one, and that was after 4 absences. So why was I still here in October then? If this is bylaws. You reenact the bylaws, read them new in September, and then you retroactive the back to the board. So I don't know how I'm supposed to know that. I'm not the staff. Maybe the attorney.
President, members of the board, the meeting is quite. Number is 5.6.22, 7.8, 9.6. Bylaws that you're mentioning were adopted by this body and on the meeting of 9.6.22. And I point out if you're concerned about the way the bylaw can be changed, you didn't even bother to give an excuse for the absence of the meeting. And the meeting, those bylaws were in the works several meetings preceding that, on which you were not present. I was a member of the board at the time, because the board adopted bylaws to govern itself in September 26, 2022 meeting. At which time they decided to make it 4 unexcused or 4 absences, did not specify whether it was it's a 4 absences of a member. And did not give a timetable that these were going to be implemented for 2020. They did not give any of that once the time they were adopted. You were not present at the time that was adopted, so the bylaw didn't want to show up. And then you presented.
Because I did show up, and it was the meeting was moved to the location. And I was only notified by email, which I specifically said, do not notify me by email. I am not a big email. You're going to email me, send me a text or a phone call, let me know that the meeting changed to different dates, because they'll verify that I saw acting on the phone. Oh, not a week before, or a week after, because that meeting was moved, and I was not told that meeting.
It's a responsibility of the members to track the meetings and keep track of the events that happen.
It is in my public list that I'm given at the beginning of every year, and it was not on Steve David.
All the same, you not go to the meeting, or look at the meeting minutes from back, so we're not present for that meeting at all. And even after that was adopted,
You are correct, that was the brought to the board, another member of this board had absenteeism, we also had no discussion for ongoing as to how to deal with that, and we've had the last year. It's been brought to the attention of the board by both staff members and the public regarding board members absentee, violation of our own bylaws, which we govern ourselves.
Taking staff members. I have a letter from staff and retired by the staff that is both Congress and board member. And I have another letter from a resignation of non-confidence in the president and vice. So I am here not for when Mr. Clay called me at my home on Sunday, asking me if I would resign because the $43.50 a month was for the duty. And I specifically put that as a terrible insult, that has been on this board for more years than you guys have been months. And I have supported the staff, saying that and you call and insult me and say that is $43.50 a month. Then you go on to write letters to the commissioner and everybody else. Absolutely disparaging me, taking things I said out of context. And throwing other people under the bus, saying that the commissioner did it. I support up to this maybe by the law. Then it also says that this letter that somebody that supports their health. And all these things that that you take out of context and then write my name to is terrible. One of the previous act is just a part of that statement for termination or removal. If I wrote a letter, send it out to the board of commissioners, and I signed your name to it, would that be reduced?
Well, it was brought to our attention, we had a meeting with the staff. The bylaws were thrown back to West. Yes, they can be more. I went right now. It's candy ordinance, my brackets, and we like that. Correct. I like following our rules, our bylaws. That is all.
Rewritten bylaws.
Well, we don't all can rewrite the bylaws. And that is one of the three, maybe you would have seen them, or if you could just read the packets that were, that you get every month. I'm just going by, I want to go by the rules. I want people, if they're gonna
Rule
call
would
me
be
out.
accounted here as a rewritten bylaw. The rule would be. that any bylaw, if the answer that is all bylaws.
Per town, is
That's
that
all bylaws. All bylaws. You can't sack a bylaw.
that's not in this bylaw. This board, I bylaw down to the bylaws, the way you were option to be a part of it, to not. That was a decision by yourself, if they want to support the residents of Seneca County, of which every member of this board has an obligation to practice the county, to represent themselves. That requires that you have to show up for the meetings, that requires that you have to be diligent. You failed to show up for those meetings, and you didn't only fail to show up for the meetings and be involved in this process. Now complain about the change that you made, oh, I was not present, you had the opportunity to make that there. You still chose not to show up following.
I showed up for just about every minute for 12 years of every meeting. So if I had a 4-month period after my 12 years of service that you pick out who would be important. One by lawyer for the board. Pull me off the board, I think. You have to give us service.
Not a lawyer, asking the board to vote some accountable bylaws, which are not supporting. The board will not put itself accountable to bylaws, which is not for itself, causing question of legitimacy, the entire health district and the board of health. You're saying rules for the meeting, not for me. That's what you're on. The board adopted bylaws.
I'm ready to bylaw. President has to be a board member for 2 years, when you can't be president, but you're already, so what do we do that? We adopt that bylaw?
Oh, it's not, you didn't show up for 2 more meetings after the bylaw. Oh, you did that. And in September, you still didn't show up for both December meetings. Which I did show up, that just wasn't required, but what's the most important meeting of our board?
Yes, that's.
have spoken to the legal counsel and he said it's problematic to that when it's time. That you can't take something too fast and kind of, obviously, you can apply it to the part. It has, I will add that.
What I was recommending. This body is being asked to confirm findings of documents. It says calendars, documents 2022, and call to the attention of by members of the staff and the county public as first, saying that the board needs to govern someone violent and not be for itself. It does not call into question the legitimacy of the operation. If you only can govern yourself as a board of police or yourself. The rules state you have to show up, we're just going for meetings, then you can see the considered vacant. The seat can be considered vacant after by 4 meetings or 5 meetings. A 6th one is called special session, which does not count for the violence, but it also creates a character component and shows a pattern of behavior. You shouldn't show up for probably the most important meeting before the Seneca County General Health District in December 29th, special session.
Your opinion, all meetings.
This one was called out for a special session just to address that matter, as a preliminary matter alone. We still didn't show up for that.
I guess I mean, so during the day, and not. When is the.
If you have a problem showing up for the meeting, then you have to recognize it doesn't work for your schedule.
It doesn't work for my schedule. Short period of time, it's not working my schedule. You're making up things, putting words in my mouth, they're not true. Say it's not true. You're going over, you're going over, it's 3 or 4 months, 9, 12. That's good. You're.
Accountability. By the rule, you got.
You were not, I was fully accountable to the bylaws, and so we changed the bylaws.
Then why didn't you show up for the meeting and have that said?
I was fully accountable for the change the bylaws.
I didn't change the bylaws for change while you were in service. You didn't bother to show up for the law.
My recollection of when we next changed the bylaw, they weren't read for that. I don't like to do that. That makes it passive. And prior to that point, Mr. Lyon, that every meeting until we got hit with COVID, and then all of a sudden, everybody wants everything back after COVID now. All of this is for squad, people going, oh, we haven't been, now we're all even over. First one, prior to that, it always, you guys weren't, but he's there. So there's a long history before that. I'm going to back him up on that one. My intent, our intent is fine. Well, specifically that Brian's board, prior other board members, we didn't, from that point on, so we do have people here who want to. Now, every time that whether I, where he wouldn't be able to be there. So it was focused. Yeah, no, I was talking. So, in general, there was a trend that he was almost there until we got, I'm going to call it, most of the man.
And that piece of pragmatic, that you're making serve on the board and more capacity, and then left someone that could be this capacity.
That's completely untrue. I have no idea.
We have an obligation to sit on the board and help show up in the meetings. It's not just in the bylaw, in the main section, it goes over on the other section, section 5 of Article 4, board members are expected to attend all meetings. These are things you got for yourself, the time you spend here. If you have a problem, then you should show up and vote.
I was every one of those bylaws, the bylaws was changed retroactively.
This kind of, the calendar, that was the wordage, the verbiage.
Before that day, it was a different rule. It was a different rule before that. It was a different rule.
Show up. But then,
I don't know for years and years and years, so you can,
you're playing
for playing games, you're playing right, if you vote that.
I know.
All
members of council. That,
and I had for a long time.
violated
I did not.
1, 2, 3, 4, 5.
But the rule says, not a year long. The vote.
Correct? And any member that doesn't comply by violence can call into question, does this body have the legitimacy in the public sign? If it's not, it doesn't matter, following violence, showing up to the meeting, and if you can't show up to the meeting, now you can change the rule. Or the not these to your.
So let's go to the president's done egregious act by writing my sign on the letter, employees, into doing all kinds of not staying on schedule with, every single one of our events has been off kilter. We don't stay on agenda, we don't do this, we don't do this. I also we report the file, say, let's have, you know, the file. I mean, let's make those programs. You sent a letter to the staff for finding that.
You had an opportunity to actually go and change anything. Anything you wanted to change in that letter?
No, I took the email, I was seeing it, I cannot change your email, I cannot change your email.
No, we all have an opportunity, I didn't change, you changed, you made a change to it because it wasn't something that you wanted in there. We have an opportunity to do it, we all did this discussion session, we all agreed with this letter, because.
That letter has been voted on, and so I cannot. You're not talking about that. It's voted on, whatever. And if I'm not signing paperwork, you cannot put on. I forget what meeting I was at.
And the other thing said, you were actually there at that meeting, that session, we discussed what we were gonna write the letter about, what was in the line.
I was there, never supported.
You were there.
Give me one.
You took action in the public session.
Yeah.
And you're not allowed.
You have to take action in the public section.
Well, then we gave you the rest, and then people that one more.
So, our divine said to do one thing, to do one thing. So what do we do as far as the bylaw, do we go back? Do we not go back?
I don't think it's up to mine.
Whatever the bylaw state, that's. That's all, if you go back, which seems kind of problematic, but what is it?
Right, so because I'm CC'd on all of those events, his guidance, his response to Dr. Will was that you're not just kicking off the board, you have to have official action out of board meetings for that. It wasn't a question of applying something retroactive, he didn't address that in that. Then I reached out and said, this appears to be the strategy, is that strategy allowable under these bylaws? And he said, applying that retroactively is problematic.
So he's saying it should be start September when we get the board. We were September. And then you monitor that, you know, it's, or who does it from September?
Our secretary, Claire, no, it's a calendar year, that's what the bylaw says. We track everything.
But that's what I was, I don't know. So, but I don't clarify on the calendar year, then where does that start? Is that, were we saying we're adopting it to start at the beginning of the year? Still,
He's saying you can't take it from this September, September 2022, and apply it to the previous portion of that year.
right, so we have to track from September to September, or is it basically, it doesn't start until like January?
Bylaws are not. Doesn't specify when it's started. You were in compliance with that. You was fine until that. They asked who you were accountable. And we described who you were accountable to, which the EAC wanted to say that there was that. So all I did was send it on to them. I used it all out and I just thought that's what I should do. That's what I should. You're done.
What if you remind me what cash? What happened?
Take that.
Okay, that's what I'm checking.
We didn't talk about.
When I install anything. That's right, but we never decide to send it in the. Exactly. You want to put something out, discuss it, send it to everybody. I did not take a photo of any action. Or decision.
That meeting you took an action, you sent a letter out of the board meeting. And then you sent an email to everybody, and that's having meetings about forum and all kinds of things.
Session, and the session, put together a letter, it's sending it before coming back to the members before. And those members, the board, are allowed to respond back, respond to that, if they want to change it. And when we're not applying, we're going to send them to it. That was the discussion back last. Session, with the back. And this body is not supposed to, has unified thing. When it showed up at the meeting again, the diligence tax credit to the district, representing, showing up for the meeting concern, we know.
We all agreed that it didn't send out a letter.
You did.
We did.
But you didn't have to take any action on it. You had to have a motion, a second, and you did not.
All the was to show that we wanted meetings to be around the chaos, and it was not a sheet. Now we had a wait.
That is the bylaws, that's working, and that's what it's supposed to do. And around.
I know actually through the work groups with one president of the city.
And they could disagree to take their opinion off, would you, their opinion?
The other piece of advice, the practical experience. That's still considered, or it's having a appearance around a meeting about like one individual. Because that was brought up and addressed in the previous meeting in 2021 and here, yes. And I was advised by a prosecuting attorney, and the board had to send a letter to the attorney general's office. Addressing that.
I remember talking about that, and it said that
That letter would also say do not reply all. That email communication said do not reply all. Let me know if there's anything that was wrong. Sort of, you didn't agree, so you don't go forward or whatever. I mean, there was only one or two board members who responded then. And a member of the public took that and sent that to the attorney general's office, indicating they thought that's a round robin. But there was the opportunity for any one of them to say something to me, and then supposedly I could say to the others. So this would be the exact same same procedure.
I don't know how to go on myself, if you can to degree. Like, what do we do? Like, I don't feel like we can go back, but specify. I don't know how you vote on that, if you don't have a black white, it's really how.
6 meetings in a year, 5 of which we plan to finalize. This meeting has been recommended to establish the bylaws. This will send it back to the prosecutor and say the board recommends the bylaws in the bylaws. Send it back to the bylaws council and decide.
No,
Here.
that's another false.
That,
I would be doing the really happy with point. That is another false. Then you play the words for the law. That's why you don't know the law, you gotta pay. I have law and I have to go to the POC. Because how you said,
You make it,
I didn't get this.
make it in the this time.
I did not. You go around and go around and around. I'll never this. Capable.
And capable of an opportunity to involve.
I understand.
Not,
I understand.
myself, and I already said,
Saying it over and over and over. How you listen, go look where I say one thing. I'm gonna say something. That's the one guy, that's why I'm sitting here, so you guys keep their best interest in mind. And it's not the $43.
line, the best.
Are you judge? Are you allowed to ask the question?
Things that you only account for, who's it not?
I've done it for myself, 12 years, for 12 years, I don't.
That was still.
I know.
Absolutely. You have to go down to tax on the tax, that's a lot of money.
Absolutely. I don't know.
Is there a way to? Do we have to vote to remove Mr. Lyons, or is there a way that we can, have it reviewed by the DAC? I don't feel it's clear on. How many were missed in the calendar?
Again, I'm gonna vouch was the lines that he's been an avid person on the board, and you're doing a lot before that, because he's able, time, I will also.
Like I did, I
Don't have
appreciate
a
that.
motion, we should take a look.
Yeah, I'm just going by what this standpoint of. So,
Yeah.
I did it.
They didn't find out that specific time.
No, but it was, it decided that I did that.
Yeah, you-
Now I'm fine. All right.
Motion is to recognize violation of bylaw, Lyons, so to create a vacancy on the board, and then to allow vacancy, to back to the DAC.
What is the kind of?
Well, they need to put it in practice, say it's gonna move from this thing forward, with it out in 2022. That comes with the order, with that all these meetings, because it's that, I'm on, so, didn't, and still missed the meetings happen. After they. Yes, engage, recognize vacancies.
Restate the motion.
Here the bylaws of the Seneca County Board of Health recognize that there's a violation of the bylaws from a member of the CDP vacated, by significant non-consensus.
I understand the commitment previously, do you feel that, I know it's busy with work and stuff, I mean, and that time, I mean, with the future, that time has passed, that you foresee that there's not. Gonna be
Consistent for 12 years, been consistent for 12
I
years.
understand, but I don't think either, for me, it's, in, like, as it said, it seems like a rush, and so just my observation is that it's more myth than not. I don't have that on for the years, but it still makes me question, and only because I remember when they interviewed for it, they asked, are you, is this something like, if you're busy, I have other obligations, I have a family, are you
We're
gonna be able to?
Always.
No.
Mr. Watson,
No,
Mr. Lyons,
no.
Mr. Hogan?
So,
Mr. Watson? Dr. Ross?
yes.
Yes. Motion carries. That's. Conservation. You go to read one. 430 West Center Street, Fostoria, 443. Everyone wants to look at the pictures? You can do it one at a time. Okay. Second for 430 West Center Street.
Second.
Any discussion? All in favor? Aye. Number 2, 310 Elmwood Avenue, Fostoria, Ohio, 43330, owned by Deborah Hayden, 5172, County Road 26, Boston, Ohio, 45881.
Motion is that.
Second,
Second.
okay. All in favor? Aye.
Aye.
And number 3, 140 West South Street, Fostoria, Ohio, 443. Aye. Aye. Next, to review and consider make change in modification of the board's contractual relations for legal counsel. The board, I see the board of health, pursue and retain, jointly the town representation from all and Jack Van Clay, purpose of environmental council, legal matter for the board of health. I have a second. Awesome. We have a second.
I'll second.
Okay, discussion.
So the board is a joint effort between, William Hall, Jack and Clay, with environmental attorneys, and like the December 12th meetings, session, you discussed looking at other opportunities or other options for legal representation. I've reached out to, individuals, they've entered into these joint representation agreement with us. Cost, is on the proposal on the first page of this thing, they have a blended cost rate, Mr. Hall will represent us in the non-litigation sense, with the gameplay will represent us in the litigation sense. Included both in this package, that communication and proposal for them, the background and their CVs, if you will, as far as cases that they represented. They worked in the environmental law for several years, we worked together, working in the past. They both seem very good representatives of what I call.
They were one of the board members for the EPA. And their blended rate for the two of them is $375 an hour, which is $25 more than our other attorney. And if should there be a litigation service, they drop the rate down to $275. It would be lost.
How many ones are offered for the percentage?
Any other discussion?
Yeah, so this is an addition to the attorney. So, but in addition to John, we're working together,
These two are important.
but now they're both kind of not with the previous.
That agreement expired in March.
I would have a discussion. I was asking. I just thought once we had this action coming up,
This is not so long concerned. We have an action within the next 20 days. Are we going to prepare for that? Council, which is exactly. I was hoping they were going to work together on it, be that and be the three months for that. That you have two people. Actually, fighting for you, two firms instead of one would be an excellent meeting.
These are two things with the heart and
One that's already been working on it and do that. So, maybe doing that together. They said that they'll be up to speed in time for this, because these guys are coming after it right away. And I'd like to not be.
these guys are very enthusiastic.
Said there's really, things that we can look at.
There are other issues, like seeing the business recognize, they have public accessible communication. Place and our proposed conditions for this vaccine, plus the response from. So those are that.
Mr. Hawkins actually talking about the law universities.
You may have a on consent orders that we can do more than the way of violation. That will be challenging.
I don't think it's.
Just in the reading I read on a lot of it has to do with consent and we're not part of this. And we don't understand.
I know Mr. Hawkins actually processed litigating against the Ohio. Another way. They are very proactive. And they're working with.
I'm just saying it's been very nice to move from council who's very familiar with this. And as previously represented for to council that is going to have to learn off the scratch. And you might say they'll get to speed, but that's going to be at the expense of my time and staff's time and pull us away from everything else that we're trying to accomplish. Because we're the ones who are going to have to provide all the documents for them to get up to speed. And hope that they truly are up to speed. Let alone the working relationship, I don't know them. Our staff don't know them. And really what we're going to have to be working hand in hand with them. I would prefer to at least meet them, talk with them, question them about what is your experience. Than just to say, okay, these guys are eager to take this on. I mean, as a person who is trying to look after the best interests day in and day out, and I deal directly with the different entities that are involved in all of this, it puts staff in very just very difficult position.
And matter of getting them as contained council, as soon as we put it in people's classes.
I mean, if there's a request, we.
I don't know. Besides that, you also have to have the prosecuting attorney go through the proper legal processes to all. And that's a totally separate process.
Now, there you go. You know that.
They're gonna be going last on the page, not last on the page. They don't have it. They're gonna have to question. We have to back to the file. That's how. Do you have an idea how much they think will take them? They do records and how much time to catch up.
They seem very, they seem very clear to them to take our awareness. We didn't talk to the documents. It's been like. I will say, not, like you represented, matters in this county once before. And was very good in respect. I reached out to him with that, and awareness that he actually was further involved in environmental concerns. It was the biggest matter that's affecting the county at one point, represented citizens in that matter, was successful in that process there. When I learned that the environmental aspect of that, reached out to him prior to this matter, now it's going to the bounds of our own background. And it's going back to itself, it's on, it helps with the one of the participation to help this. But they both, this is a little different background discussion. So, those, not on litigation, the other one is going to hurt.
They were both EPA lawyers.
This is all, this is the key on this, this is we have. We wanted to, I don't know if they work together or not, in the overall. But that's how, let's say, the staff and burden on the staff, and everything they have to use, have the previous attorney produce. To reduce the burden on everything and the staff. We should already have that, they could have a disclosure anyway. We have to turn file over.
I don't know what I'm allowed to comment on. I don't know, and, I know that when the community looks at things and when we have a legal counsel that says, here's how you're going to do this. I don't have a lot of confidence. I'm sorry, that's just my personal opinion. I don't want to have a lot of that personal opinions.
So my experience having been in the city law district, and city law directors who were present at our meetings. The explanation they provided was, my job isn't to give you the opinion you want, my job is to say whether I can defend your action for it.
And we have two attorneys on instead of the we have two instead of the to that, whereas the attorneys Seneca. These days,
That's all we can say a lot. I was.
Going by our previous experience.
I didn't watch.
This would have been fantastic. I agree with it. We could have, but everything seems to be done all in the
I can, that. A little bit, even if that's actually I'm thinking it's being worked on for how long, and sort of, make you feel comfortable enough.
That is, I'm 1,000%.
Yeah.
Let's get there. I think if we pump the brakes, we may lose ground. Oh, we lose ground.
Where we need, where would that?
Well, we got some consensus that they had.
Yeah, but our lawyer said he had nothing to do with that. He said that, he said, I had nothing to do with that, Seneca County had nothing to do with it.
I was at this.
This is what they're told me to my face.
I was at those meetings. We were. The original number of 2 years. Yeah, that was part of that, I mean, was to get concessions, to get this moved up, they did not have that, so that was part of it. To say that nobody had anything to do with this, it was wrong.
Well, then he said that to us. That
Yeah.
I think it was the consent order, the consent order refers back to its knowledge. Right, because he wasn't involved, that's the state of Ohio, representing EPA and some farms, and they're responsible. Those are parties of the consent committee, they did not involve us. So how would the health district know they were working on the consent order?
Yes, the one that didn't invite something.
My observation is that there's, it seems to be concerned as far as communication with some balance in terms of the board as well as the public, the prior council, while they may have represented this body. To a certain extent, in the last couple of years, it hasn't been given control of confidence. Represent these individuals recognize. Seen them, they should be made. And so that there was avenues to. Avenues that had been conceived by the fire. They used to help in the process. More detail.
I guess what I'm, why don't we have, you guys, the first two of those avenues, that you guys had to pursue. Let these guys finish with this upcoming thing that's. On the day, they're doing this. You know, it's about 40 days.
I would want to sign your contract with the attorney that said that you didn't really. Defendants.
I would say sign the contract.
That's.
They require a year and said you can't amend that version, says through the.
But I can tell you the hearing process will be done in 20 days. Because the process is obviously negotiated between. So the farmers attorney and the council, they negotiate the process, and then they simply require to get down to 20 days. So last time around, I had to do 7 months down the road. Because you also have to determine who is the hearing officer you're going to hire. How that person has to be done before you get the have a contract with them. It's not a big process.
And in the meantime, it's something wrong with the operate as it's.
So we have several lines. So there's several months. Well, I don't know if we truly have several months because I don't have a response.
That's why we need to get it.
So we don't have several months.
And we need to.
So it could be like something needs to make, get into that process, the prosecutor is just, understand what we say, and the person to do is give a response, and sometimes you can start the process, which are, the comes to be able to, get records from the previous council. And further bringing this all over the speed, I think necessary, where the Board of Health, with that.
Anybody, you know, outreach of the previous, from my experience. And that, you know, it's something capitalist. What you're saying is the public wants to go to the council, the only thing it's so fast, this is the way everything else that we're all doing. But I also don't. I would like to see this guy stay a month and not a year. Because the contract is the work it does for us, and we just don't use it anymore. And it's still you're not.
That's what it's always been. It's
Oh.
so
So we don't have to use it here. Just for these guys want to come to the, I think the delay that it was here. Oh, and
if we vote to continue to use one, or we bring it back to the job. And we use easement, and it's maybe like you said, it's on the-
I think you're also assuming that they would want to.
Yeah. I guess if I'm not about if one of them just handle the appeal process. Then you have the other guys that had success.
Both of them have.
It's like it's a plot now. The two firms, Walker and that are two firms together, I understand. And Walker, I think is more currently used. I'm saying we should keep Walker being just for the sake of. You have an appeal process, right? And then you just utilize it just for that appeal process. Then all the new concern That you can sort of offer a example, I went to, and then start them on that.
I'd recommend retaining one of the council. It's in the law, letting them do the work of the, and represent the people.
10%. That is the environmental appeals commission, state level. Typically, that is possibility.
We want this attorney to turn out with their file.
Because Derek's comments, when I got the road, this was, there's certainly nobody in the office, and or anybody else's office, could do that, could take this on and you know, really have an expert counsel. You probably can find it store, but you know, you usually have time to place it before you start taking actions.
Their experience, attorneys, who would find the law, which would be with their extent of activity. Motion, items, play, and, state rule, federal method. Second. You made motion.
So this is this. Routine law, main plan, routine, and that's.
We have a second.
So I guess I was understanding, again, so it's that we became council, but not add additional council.
It's really really involved in the ranking, playing, the team in this council, matter, finding.
As, not just ask, can we say that in February or March? Something like that.
Yeah. Yes.
So it's doing the same thing over and over, but the same word. Yes, let's have to consider like that. We have a lot of things to do, we have a lot of other things going on. Consideration.
Yes.
Yes. Motion back. Since we're basically the contract with the new hire law, Eastman Smith. Special version, Friday. 7. Financial transaction. Payment of bills. cash in hand, number one, 20,000 from 7060.
Okay.
Okay, all right. I got them all. We have. Also, second.
Say aye. Agree. Aye. Aye. Financial transaction, cash advances. Number one, $20,000 from 7060 -0705 -5398 General fund advances out to 71300007 402900. Receive right advances. Number two, $20,000 from 7060 -0705 -358 General fund advances out to 7150-0007 4-029-00 for COVID pension protection and mitigation and confinement facilities. I have a all there. Next, see, interfund transfers. Number one, $50,000 from 708-704-506-00. CNBB contract services 27089-0714-5332-00. CNBB remains state. Number two, $605 from 07089-0714-5303-00 CNBB supplies 7089-0714-5102-00 CNBB salaries. Number three, $1,000 from 706715-5102-00 state North solid waste salaries. 609-0715-5306-15 solid waste software license. $900 from 764-0709-5309-00. HSPS miscellaneous. 5164-0709-5306-30. Number five, $1,750 from 7164-0709-5309-00. HSPS miscellaneous to 7164-0709-5307-00. HSPS $630 from 7082-0709-5307-00 for wind travel to 7082-0709-5365-01 HSA. I have a motion to accept this. Second.
Second.
All there. Rename. Return resolution is done. Okay, P, contract agreements. Number one is the National Association of City and City Hall Officials for medical reserve for rise to beach services effective upon signatures through 10/15/23, that would exceed $50,000 to be paid. Two, Warrior House in for COVID-19 protection and mitigation of confinement facilities. 11/1/22, 31/23, not to exceed 134,545.45. Here, the Board of Health is going to be dead.
It is that. So next line, what about this?
Number three, Seneca County Sheriff's Office for COVID-19 detection and mitigation of confinement facilities. 11/1/22, 10/31/23, not to exceed $60,000. Number four, GO FISA for H2 home Idaho, home sewage treatment system, soil evaluation and system design. Manual property. 126/23 through 11/20/23, not to exceed 29/7. For H2O, I don't sewage treatment system, soil evaluations and system design, survey property. 126/23 through 11/20/23, not to exceed 29/7. Geophyta for H2O, sewage treatment system, soil evaluation and system design. 196, 122, 123, not to exceed 29/7. For H2O, Ohio, sewage treatment system, soil evaluation system, Myers property. 126, 123, 11/23, not to exceed 2019.
So number two and number three are both for the COVID-19 detection and mitigation compliant facilities. Basically, we serve for most of it as a passport. It's for them to make improvements to the jail and to Prospect to reduce the exposure of individuals to one another. There's things like COVID and other types of infections. So, yeah, Oriana House is the company that operates in Prospect and other places. Yeah. Combining facilities, specifically jails and community corrections.
There needs to be order rise to space.
There's an MRC grant, meaning MRC stands for Maryland Reserve Board. That was a grant that was submitted to the National Association of County and City Health Officials to help us to establish our Maryland Reserve Board, which has been really helpful during COVID, and we have more work in that staff. And so they're designed for specific emergencies, as well as medical personnel, environmental personnel, non-medical personnel. But it's basically to help us get that back up and going. It's a long-term project. We completed the project of medical reserve was long-term. This is not a long.
Motion to approve the contract. Second.
All in favor? That's continuing.
So this wants continuing education session for the public, it's to the foundation. To introduce you to the framework, which will be contained and underlies all of the other continuing education sessions this year. And this is part of a commitment that's, related to Ohio Revised Code 3701.42, which we find for health members to use 2 hours continuing education annually that relates to ethics, principles, and management responsibilities. So the foundation of public health services framework relates to public health medicine. Next slide, please. So the basis of this actually pre-exists, probably nearly all of the yes, except maybe stop. Back in 2011, the Association of Ohio Health Commissioners established the Public Health Futures Committee to critically assess the feasibility of sustaining 125 local health departments and to develop proactively new approaches to improving our effectiveness and efficiency. And so we looked at new basic structure of local public health. There was a steering committee of 17 AHC members of a wide variety of health departments across the state, urban and rural, city and county, and all regions of the state that took on this 9-month planning process. The project guided all AHC members through a critical look at the current status of local public health and a careful examination of jurisdictional shared services and consolidation as potential strategies for improving quality and efficiency. So that is literally what the first cover looked like, and that's a list of participating health commissioners that are part of that project. I was serving in Henry County. Next slide, please. So the process prompted us to look at the role of public health, local public health type by defining a minimum package of local public services and to assert a vision that upholds the values of community engagement, quality, accountability, efficiency, and public health science. And so the steering committee recognized that local public health infrastructure and safety need to be strengthened or would need to be strengthened to ensure that all health departments would be capable of providing this minimum package of services. So in this package, there's what are considered what we call core public health services, in which which are services that are needed in all health departments for the public health system to work effectively at all. And then underlying them are foundational capabilities that are needed regardless. I mean, and there are many of those are foundational capabilities in all types of businesses and sectors. So like having access to laboratory capacity, that's where you need to help public health. But resource development, legal support, quality assurance, information technology management, those kinds of things. And then the section is outside, the orange section are other public health services. Things that might be unique to one particular county or jurisdiction because of local needs, but they're not something that all departments across the state require. So at the same time we were working on this, similar work was being done in the states of Washington and Oregon. And noting that public health transportation information doesn't work in isolation. The Public Health National Center for Innovation pulled together what they call the 21st century learning community. The first 3 states were Ohio, Washington, and Oregon in 2015. And then additional states have jumped on or have been allowed to participate going forward in time. And those states have to be both ones that are focusing on intentional statewide public health system transformation. So this steering committee, this ended up going to the legislative committee that was established, one of the previous budget bills at the same time, and became the basis for actions that the legislative committee took, not necessarily that were actions recommended in this futures report, but the legislative committee went further in many ways, and that's where the requirement to achieve accreditation for all health departments in Ohio, as well as the continuing education requirement for boards of education, boards of health, things like that. So if we go to the next slide, about the same time, there was also an Institute of Medicine report that came out called for the public health, investing in a healthier future, and it too called for a minimum package of services In other words, the suite of skills, programs, and activities that must be available to state departments everywhere for the public health system to work anywhere, and for which estimated cost could be estimated. And so this resulted in a conceptual framework that describes what the foundation and the programs that no health department should be without. And so the work of all those things all together led to an initial introduction of the foundational public health services model, which is on the next slide. So this is how it first appeared, where the foundational capabilities are displayed on the bottom, but not in a very nice graphic way. And then foundational areas fell in two categories. Those with foundational fall is below that line. And then those foundational areas that were unique to a specific jurisdiction and a community's needs are what we call above. So this work has continued to expand and grow. And the next slide shows you the current version of what that framework looks like. And it outlines the unique responsibilities of governmental public health. It defines the minimum set of foundational capabilities and foundational areas that must be available in every community. I'm going to provide more of a general overview of this framework, but over the course of the year, health district staff will be here to share with you specific examples of how the work they're doing, or how we're providing those foundational public health services here in our county, as well as highlighting some of the barriers that we face that limit our ability to do all of them. So when we look at the foundation capabilities, these are cross-cutting skills and capacities. Next slide, please. That are needed to support basic public health protections, programs and activities that are key to providing fair and just opportunities for all citizens to be healthy. They're considered to be so fundamental that they need to be present everywhere in the public health system to work anywhere. So, for example, health departments serve the communities 24/7. I've gotten some of those calls in the middle of the night related to somebody who's been exposed to Ebola. And so you have to have ready access to critical data sources, robust lab capacity, preparedness, and policy planning capacity, along with other things, to be able to respond in a timely manner. So there's 8 foundational capabilities that are displayed, and we'll go through each of them and provide a little bit of an overview of them. So the next one, then we'll start with assessment and surveillance. And so these are some graphical ways of explaining what's considered in there. But practical local examples, this foundational capability includes the ability to collect, access, analyze, interpret, and use data from a variety of sources, being able to conduct a collaborative community health assessment with our partners in the community, and to identify health priorities arising from that assessment. The ability to assess and analyze disparities and inequities in the distribution of disease and social determinants in the health, which make it so that some people are higher risk for health outcomes. The access to labs 24/7 that are capable of providing rapid detection of new or emerging infectious diseases. So those are just some of the examples that fall under assessment and surveillance. In community partnership development, this one really focuses on our ability to create and support and sustain strategic, non-program specific relationships with key community groups or organizations that represent populations experiencing health disparities or inequities, private businesses, healthcare organizations, relevant federal, tribal, state, and local government agencies, the left-hand column. And another example is the ability to convene across governmental agencies, such as Department of Transportation, AG, substance abuse, mental health, education, planning, development, to promote health, prevent disease, and protect community members of the health jurisdiction. The third foundation capability is equity, and this one actually permeates everything, all of the various different foundational public health capabilities and foundational areas. And this is really about the ability to strategically address local and structural determinants of health through policies, programs, and services as necessary to operate and achieve equity. And so these pictures actually illustrate the difference between equity and equality Equality is where you make sure that everybody gets the same thing. But in equity is where you make sure that you give them the right amount of whatever together so they can all reach that tree, for example, so they all have the opportunity to reach their optimal health. And it also involves the ability to work collaboratively across the health department as a whole and the community to build support for and foster a shared understanding of the critical importance of equity to achieve community health and well-being. The next one are what we call organization competencies. This is actually a really broad group of things. So it includes 4 basics like leadership and governance, information technology services, including privacy and security, workforce development, human resources, financial management, contract, and procurement services, including facilities and operations, and legal services and analysis. And so these are really those things that are pretty organizational competencies for all lots of sectors. They're not just unique to public health. They're things that you need for any business organization to function well. So some of the companies a whole lot of having access to technology that's current, having the ability to engage with government entities around legal authorities and what might be needed or not needed, being able to establish a budgeting, auditing, billing, and financial system and charging expenses that comply with all different laws and to be able to secure grants and lots of things. The next group is policy development and support. And this capability relates to serving as a primary expert resource for establishing, maintaining, and developing basic public health policy recommendations that are evidence-based and grounded in law. It also involves effectively forming and implementing policies being considered by other governmental and non-governmental agencies that can impact the health, physical environment, social, and economic conditions that affect health, but they're beyond the immediate scope or authority of the health department itself. And so it's really about providing insight and input to others that are developing policies that impact health, but they're not directly in the our jurisdiction. The next foundation capability is accountability and performance management. And so this is really about our ability to perform according to accepted business standards in accordance with applicable laws and policies, maintaining performance management systems which monitor our human and organizational objectives, identifying and using evidence-based policy practices, and maintaining an organization-wide culture of quality, and to use QI methods. Emergency preparedness and response is the seventh of the state foundation capabilities. And so this one probably is a little bit more obvious or not as foreign in class it might have been in the past prior to the pandemic. So this foundation capability relates to the ability to develop, exercise, and maintain preparedness and response strategies and plans. Activating emergency response personnel and communications systems in the event of public health crisis, coordinating federal, state, and local emergency managers and other first responders, private sector, and non-profit partners, and operate within and as necessary leading incident management system. It's about maintaining and being able to maintain and execute a continuity of operations plan. It's called COOP. Being notified and respond to events on a 24/7 basis, and access and utilize laboratory response network reference map for biological agents. So those are just some of the examples of what falls into this one. And then the last one is communications. And there's lots of things that fall in this category as well. It's the ability to maintain those relationships with local and statewide media, including the ability to write press releases, conduct a press conference, use electronic communication tools, effectively use social media to communicate directly with community members, the ability to tailor communications and the methods you use for certain audiences. Recognizing that not everybody has or uses Facebook or Twitter or any other method, that there's a variety of different ways that are right for different needs, different populations. The ability to transmit and receive routine communications, not just in emergency situations. So then the next slide addresses the foundational areas. So these are what are supported by these foundational capabilities. You can't do these 5 foundational areas very well, don't have a foundational capability in place. So I'm not going to dig into these because these will be more of what staff will present on through the year. So the foundational areas are preventing the spread of communicable diseases, preventing chronic disease and injury, ensuring food, water, and air quality, safe, supporting maternal and child health, and improving access to clinical care services. At the very top of the section, people are going to do the next slide. It doesn't look any difference, but what I'm drawing attention to is there at the very top of those community specific services. And so that's highlighting that different jurisdictions may have different needs. And so that's where you see the differences between health departments. That perhaps one county doesn't have any local immunization providers. Well, then it's incumbent upon that health department to fill that gap. But other counties might have plenty of providers that give immunization. So that department may not give immunization, except in emergency. So it's what's unique to a community's needs that you won't see across the board everywhere. And then finally, I want to show you the next slide. So how does this work here in Ohio? Or what's one example of how this is implemented in Ohio? Since Ohio is one of the states that this whole effort started in. So we've really focused a lot on determining the cost of providing foundational public health services. So the Association of Health Commissioners worked with the Ohio Department of Health to actually incorporate this framework into the annual financial report that we submit to the Ohio Department of Health. So, for example, we report labor costs and non-labor costs for each one of the foundational capabilities and the foundational areas. And so one of the improvements we're making here internally is adopting an electronic timekeeping system that we've already structured so that we will automatically have it aligned with these categories. It'll be a much easier process than completing our annual financial report. The spreadsheet that's part of the annual report, calculates what that investment per capita. So you can see striking differences between different areas, and it helps identify where are the gaps. Where is the health department not putting enough effort in, or is there not? And because usually they don't have the funds to do it. So so that's what this framework is being used for here in Ohio, one of the ways. So that's the foundation public health services framework. And as I said, the future continuing education sessions are going to focus on what are the examples that our staff are doing that will fit with this.
Public comments. Yeah, there's people that are very speaking.
I think it's nine of this. I will. I'm bored, so somebody else can go ahead.
I'll go. Brian, I represent Win Waste Innovations. I would encourage you all to read the response that we provided in our request for the public hearing. Please read that. One thing you're going to read, there's a lot of value in what we talked about in there. We laid out inconsistencies and the facts of the matter. I have read the community health services assessment, and I noted that 39% of the local adults are obese. I noted that 38% of the local adults have high blood pressure. I know that 43% of the local youth was bullied in the past year. And shockingly, I noted that nearly 1/5 of the local youth seriously attempted suicide in the last year. But this board spent the majority of their time today talking about a landfill that is in 100% compliance with the applicable regulations that sits on the extreme western edge of the county. This board today, as a majority, voted to change from an attorney based on the recommendation of a couple of the two newest folks on the team here. their recommendation based on their vast experience in environmental law to change a legal firm in mid-swing, right in the face of an action the board has taken that's unprecedented in the state of Ohio. This is going to subject both entities to a lot of time and cost. That time and cost would be much better spent working on things that have been identified in the community health services assessment, or any of the many questions that the public at large has about the landfill. I hear citizens concerned about groundwater. I hear the board themselves last week expressing, or on the 29th, having questions about confusion about hydrogen sulfide, how it's monitored, what it means. Another board member knows that they've never read the consent order. A lot of questions about that. This time that we're about to waste on this hearing, all of the things that we're going to go through would be far better spent working collaboratively to answer the questions that the public has about the facility. 4 years ago, 3 members of the current board held a tremendous change in this community. They brought a willing participant to bear to enforce change at a facility. Since that time, that site has operated in stellar compliance with everything that it had to do. We spent 3.5 hours on Tuesday with your inspector walking over every inch of that landfill and observed, once again, no violations at the site. Don't take my word for it, take the state's word for it, take the sanitary and the two fire. The site is in compliance. There's a lot of other things that have happened in the past that needed to be reviewed, but that time is gone. We're 4 years past that. The public record, what we're hearing in the public, what we're seeing in the press, what other folks in the community are saying, that this is all old news. This is not what this board should be spending its time on. We're talking about denying a license, removing an experienced attorney, removing members of the board who've been there for years. The voice of reason is going away. These are all things that are going to subject the taxpayers to money poorly spent. That's what I would say. We're going to be around here. This company, Wind Waste Innovation, is here to stay. We're continuing to operate the site the way we are. It's very important to us. You have a willing participant who's going to comply with the regulations. Thank you.
Can you pull up slide 10?
Just to start with, I am not retired, but I do set my own hours and I work for myself. So if you need help sending out all the PDFs and emails to the new attorneys, I would volunteer for that. If you need more help. Assessment and surveillance. Geez, public health right over here. I understand the consent order. I see what they're building out there, 20 million to capture the bad gas, turn it into good gas. But I think a lot of the people that live near it, the whole community, doesn't want to see it, and they really don't want to smell it anymore. And you're right, it's probably not going to go away, but somebody needs to monitor it and surveil it. And the EPA is not doing it because they haven't been out there more than half a dozen times in the last 2 years by their own concession. So I don't really have a big problem with the landfill, except that they would follow the rules, which they never did in the past, which what makes us think that we're going to in the future. So I think I applaud you for, getting another set of attorneys on board. I've been at more meetings in the last year than Mr. Lyons. So if I would, and I thank you for your 12 years, but I would back up cashing your last check for the half of last year. That's for sure. And the other thing is that you're probably going to need another attorney. You don't follow your bylaws and you don't follow Robert's Rules of Order, because somebody's going to bring a suit against you and then you're going to have trouble, more trouble than you already got. And if this was all developed in the state of Oregon and Washington, okay, I guess that's all right, but I'm not a big fan of how they do things out there. So that's my 2 cents worth.
Okay, I get signed off. Right? Okay. I'm Susan Platt from Loudon Township. I'm one of the founding members of Rat Patrol Residents Against Trash. We've been at it since 1993. And I know it's a big job, Commissioner, and I'm concerned that you feel so overworked. The attitude that you brought forth to the table when it was mentioned that you'd have to send emails, et cetera, that's very concerning for us. It's also concerning for citizens for open government that you have violated your bylaws. There were 2 people that voted to keep your bylaws and the rest of you voted against it. That's a concern. The citizens for open government are working for transparency in government. We don't want to be fooled. We don't want to feel that we can't trust you. I do have a few other things. The Advertiser Tribune article from yesterday failed to mention that the Board of Health proposed conditions to Sunny Farms, and all of those conditions were denied by Sunny Farms. The AT article failed to mention that Sunny Farms denied access to water sampling because they didn't want a Board of Health employee to destroy the environment by collecting the water. What business denies access to inspections or testing if they operate 100% lawfully? What would the health department do if a local restaurant would deny access to inspections or testing? They would close and fine the restaurant. But rules for Sunny Farms are different than they are for other businesses in our community. It appears that Sunny Farms wants to make their own rules, which include self-monitoring of their own operations. COG, or Citizens for Open Government, would like to thank board members who are fighting and representing the values of the residents of Seneca County. As a board member, you are a public official, and you should always represent the interests of the citizens of Seneca County and not the interests of a for-profit corporation with out-of-state owners who are making millions of dollars by dumping dangerous waste in our community. The Board of Health mission is, as Clay read, protecting the environment for the residents of Fostoria, Tiffin, and Seneca County. Please continue to protect our community, the citizens who work and live here, and our environment. Thank you.
Would everyone like to meet Dr. School? I know the board member who was here, and she's on the list, and I know she wanted to speak. That is all. Do I have a motion to adjourn? Say aye.